Julie Lloyd from Belton Veterinary Clinic, and this is my horse Martesa. And I want to show you guys what I keep in my tack trunk, and I'll demonstrate various bandaging techniques on different parts of a horse's limb, so you can practice that on your own horse in case of an emergency. This video is not meant to replace any sort of veterinary advice from your veterinarian. It's merely just a guide, a practical guide for what you can keep on hand for your horse, and different techniques that you can use with your horse, but always refer to your veterinarian regarding your horse's care. Call your veterinarian in any case of an emergency, so they can guide you as to the best practices for your situation and your horse's individual needs, okay? So this is my tack trunk. I want to let you know that this video is not meant to be a replacement of any veterinary advice from your veterinarian. It's just a practical guide for what you can have on hand in case of an emergency. So anything that's going on with your horse, always speak to your veterinarian, call your vet at any time you have an emergency, and that way you can be properly guided as to your horse's individual needs at that time, okay? So this is what I keep in my tack trunk. I'm a horse owner just like everybody else, and I found some practical items to have on hand in case of an emergency. Some of these products you can actually get at your local pharmacy, and some of them you might have to buy on hand at a specialty tack shop or veterinary clinic. So the first things that I found really practical are these saline and iodine wound washes. These are great solutions to have that are aseptic, clean, and easy to put on your horse, and they're going to be safe for any wounds. You know, you don't want to put anything on a wound that you wouldn't put in your own eye, and so saline is physiologic, doesn't hurt or sting, and it's clean enough that you can use this if you don't have a hose nearby and keep it in your saddlebag to clean off a wound. Iodine is also really good to put on a wound, as it's antiseptic and can kill bacteria if you have a really quick wound to clean up. Other things that I have are peroxide. I wouldn't put peroxide in the eye, obviously, but I do use this, as you'll see, for a lot of feet things on the hoof as a drying agent. Peroxide is really good initially. Peroxide is really good initially for like minor cuts and scrapes, as it cleans the skin really well and kills bacteria, but I wouldn't use it over and over again on an open wound, as it can actually kill cells. Something else that I have is a hoof poultice. This is an Epsom salt based poultice that you can use this to wrap a foot with to draw out an abscess. You can use it on limbs, but I do like to use a different material for sweating limbs and swollen limbs, as it were. But this is great for soaking feet for abscesses if you don't have a soak available. Something else that I like to put on wounds is this type of triple antibiotic ointment called a silver sulfidine cream. It's really gentle and safe to put on most open wounds. Something that I do also have in my tack trunk that I might put together for a sweat to take down. This is not for use on an open wound, but I do use this to sweat a limb to bring down swelling on a limb. I might mix some DMSO and furazone. Keep in mind, if you're ever using DMSO, you have to wear gloves, as it can be carcinogenic and damaging to yourself, so be careful. Something else that I have for foot bandages, as we'll demonstrate here, I can pack a liniment on a foot with magic cushion and good old duct tape. Good duct tape is a good all-around bandage for the feet. You don't always have to have a product like this, like a foot boot, like the Soft Rise or a Cavallo boot or Cloud boot for packing feet. When you don't have something like this to keep the feet dry or cushioned, you can always use duct tape to pack on. Something else that I've had in my hand here that are really easy to get at the store are diapers, as well as feminine pads. These are, clean materials that you can use, and if you don't have conventional bandaging materials with you, these will do on the trail to just put in your saddlebag, and they're absorbent and they're clean and non-stick, and they can work for most wounds. The diapers actually work great for foot bandages as well, and packing feet. So something that I keep on hand because I have access to it is just a regular triple antibiotic eye ointment without any steroid. Always have your eyes, if your horse comes in with a scratch or is squinting its eye, always have it checked out immediately by a vet, because horses only have two eyes, and they're out there for them to get abrasions or scratches on. So it's better to just get it checked out as soon as possible and wait for something to happen. But I always have this on hand. Again, always speak to your veterinarian about medicines before administering them to your horse, but something that I commonly have folks have on hand initially is some phenylbutazone, and some Banamine in case of an emergency. Again, always talk to your vet about administering these medicines before doing so, so they can guide you, but I do have these in my tack trunk just in case of an emergency. I do think it's important to have a stethoscope, know how to use it to take your horse's heart rate and respiratory rate, and listen to their lung sounds. It'll come in handy if you ever have an emergency, and can guide you in talking to your veterinarian about what's going on with your horse. I also have some fly ointment repellent that this is an ointment you can put around a wound if it's something you can't really bandage but need to keep flies off without having to spray fly spray right on the wound. That won't help heal. The other things that I have for bandaging material are nonstick pads and rolled cotton. And rolled cotton gauze like this is really soft, and you can never get too tight on the limb. And I'll demonstrate how I use that. Of course, vet wrap, easy commodity, as well as some sticky elasticon tape. You can get this at the tack store or your veterinary office. I do, at the vet store and tack store, they do have full bandage combines available, but if you're doing recurrent bandage changes on a chronic wound for a horse, it might get a little expensive if it's taking weeks to have to heal and needs bandaging every day. So I think it's really practical to have these stable bandages that can act as a third layer or tertiary layer of the bandage that's going to be protective for the limb and cushioning, and combine that with your stable wraps. And if you know how to put these on properly, you really can't go wrong. And if they get dirty, you can always just throw them in the wash and you have 3 more for your horse. So I think that's about all that I have in my tack trunk, plus some other stuff. But this really should get you good and started for bandaging your horse in case of an emergency, or taking care of a wound that you might have. So we'll go ahead and we'll demonstrate on my horse how to do different bandages on different parts of the limb, and how I do it. All right, so I'm going to demonstrate a typical foot bandage. Like I said, there's lots of things that you can use. I'm going to use a diaper. And let's say I'm treating her, I soaked her foot for a foot abscess that I found. And I did, soaking with iodine and Epsom salt and warm water. And I cleaned off the foot, and I want to just keep it dry until the next time that I soak it. Or I found an injury to the foot, like a nail in the foot or something. I've already talked to my vet, and I want to keep it clean. Just some advice I'd have, if you find something like that in the foot, you can always, on the sole of the foot, you can always use peroxide to clean the foot, as well as your hoof pick. So I'm going to pick up the foot, and I've cleaned off the bottom of her foot. And if I use this diaper, you'll see how easily it conforms to the pad of the foot right there, and it makes a nice little bandage. I'm going to secure it with some vet wrap. I start over the bar, going diagonally around the foot, and then I'll go around the edge of the foot. And you can get this pretty snug to keep it on until next time. I'm just going to use the rest of this. And right there. And that's a pretty darn good foot bandage. And what I'll do to secure it on top, to make sure it doesn't slip off, because this is good for now, is I'll use some sticky tape. The secret with this elasticon sticky tape is don't has a stretch to it. Don't use the elastic capabilities of this and put it on super tight like this around a horse's foot, or especially around the tendons, because you will strangulate the leg. Use the stickiness of the tape. Like I was also saying before, you can wrap this foot too with just duct tape if you don't have any vet wrap, and that'll help you, hold it until the next time. So I'm just loosely putting on this sticky tape. I stretch it out, just place it on just like that. I have some scissors in my pocket, and that's all I need to keep the foot bandage on. Okay, the next bandage I'm going to demonstrate is a little bit trickier. I'm going to demonstrate for what would you do if you had a heel bulb laceration or a pastern cut. You can actually see Marquesa, when she was younger, she got caught in the fence when she was a yearling, so she actually had some dried scar tissue there. This is a really tricky area to bandage, but what's really common too is horses will get a heel bulb laceration right here on the sides of their foot from overreaching with their back feet. So this is quite a common injury, and you're going to want to bring your horse to the vet so they can assess it for any damage to really important structures. But what you can do is you can use the diaper, just like I had demonstrated before, to bandage in and around that area. You're going to have a bandage that's probably going to go over the feet. And so if you have a very low heel bulb laceration, I put the diaper right there, put a foot bandage and then supportive bandage there. If you have a cut around the pastern, I would use this non-stick pad. You can also use a menstrual pad. They're clean and they're absorbent. You can also cut the diaper to any size that you might need for bandaging this area. So I'm going to use my Telfa, and I have my roll cotton here, and I'm going to place it strategically just like this against it, and making sure I'm letting my horse know I'm here, and I'm going to place it around this foot. And I might have to pick up my horse's foot or go low enough around the back of the heel bulbs and then back up to place a supportive, basically pastern foot bandage, just like that. You can see how I can't get too tight with this material. If I do, it tears apart, but that really works well so you don't damage any vital structures, like your ligaments here. Next, what I would do is I would place some vet wrap around it, and again, you might have to pick up your horse's foot to really get underneath the heel bulbs. Marquesa's behaving here. Put it on just like that, just a few rolls until I can get her to the vet. And even for managing a wound there, if you have stitches there, this will do just fine too. Depends if your horse has a cast on or not, if you're going to be doing those types of bandages. Once again, I might pre-stretch this elasticon just to help me get initial bandage on top. And I actually don't like leaving tags like this. I might just go ahead and make a nice straight line, because I want to have enough contact with the skin, about at least an inch on the skin and hair, that this bandage isn't going to fall off, and no tags that can peel off, just like that. And this way it's not too tight around the heel bulbs. Again, this is more, I'll demonstrate a supportive bandage that I would have as well as with doctoring your pastern injuries. But this is a good bandage to kind of stay on until you can get your horse to the vet. Again, you can also pick up the foot, put some elastic on the bottom so this doesn't ride up. But this is a perfectly appropriate, quick, easy bandage you can do for tricky situations such as the heel bulb and pastern lacerations or cuts. Okay, next I'm going to demonstrate how you can do a bandage in different areas of what we call the metacarpus, or the cannon bone area. I've had, a lot of horses have gotten some biopsies or some sutures around here, the fetlock. I also seen a lot of horses that cut this front part or even the back side of their legs. So I also had a horse that removed a splint bone and has some sutures here. So these are all like, in this general area, you can use the same basic principles of wound care and bandaging in this area. Again, I think I, would best use this Telfa pad, a non-stick pad, or a menstruating pad, or even your diaper if you have a large swath of area to cover, if you have a big wound on this area that you can use to cover the wound. Something else that you can use from your veterinarian is an abdominal pad. But again, your diaper or menstruating pad or menstrual pads will work great. You can actually cut the diaper to size for that wound. So say I have a wound, over here that I want to use this Telfa long ways, or on the front. Let's say the front of the cannon bone, since they tend to go around. I'm going to use this roll cotton and Telfa as my primary bandage, and I'm going to cover this area initially just to get something clean on that area. Okay, next I'm going to use my stable wrap. Again, you can use a combine or more appropriate, or a cleaner type wrap that's going to go around the leg. I, out of habit, tend to wrap my legs from front to back and then inside. But as long as you're consistent and even with the pressure, it doesn't matter. This is a perfectly good clean initial primary bandage. This is going to be my second layer. And so what I would do for this area is stay really snug around the tendons. And then I'm going to use my stable wrap. You can also use a polo wrap initially to get it on. If you're really in a pickle, a polo will also work really well. I have a tendency to kind of be snug over the cannon bone area and then go around the ligaments and around the fetlock. You do have to be snug with this because it can slip a little bit. So if you're doing this every day, if you're managing a wound on the front, and say you've treated it, per your vet's recommendations, either with saline or the hose, water, and hydrotherapy, and then put any sort of ointment that's appropriate for this wound. Then you do your non-stick padding, then your cotton, and then you put this bandage on and your horse is out in the paddock or something larger. You might have to support this with some sticky tape on the bottom and the top. You can also use this padding, or combine with your vet wrap in place of this. But again, these bandages, they can get dirty. You can throw them in the washer, and then you still have, 3 more to go, and you can alternate that way. But sometimes to give it extra support, I will have to tell my owners to put some sticky tape on the bottom and the top to keep that up. All right. A little bit more complicated, but I promise it's super easy, is a cut or a wound on the knee area. Seen horses scrape up their knees a few times, or have to get stitches or a wound on the knee and the lower limb. So same kind of rules apply. I'm going to use a non-stick clean padding on my roll cotton. Patience, Mare. So I'm going to use my Telfa pad or some sort of non-stick padding and cotton, and say I have a wound over the front of the knee. I'm going to go over the knee, and the secret to the knee and hock is you just got to listen to what the knee wants you to do in terms of wrapping, okay? And it's super easy. Again, it's really foolproof with this kind of material. Again, I prefer this kind of roll cotton versus like gauze that can kind of rub on the horse. So kind of going in an X-like pattern, very subtle. And again, if I'm done, I'm going to just either cut it off or pull it off, and it won't get too tight. Okay. Next thing I'll do is I would do some vet wrap in this area because there's no easy way or attractive way to put on a stable wrap. And I'm going to leave enough white showing. And just put on this vet wrap, not too tight around the knee, so I might stretch it out, but allow that you can see the ribbing of the vet wrap. Okay, no wrinkles, nice and flat. Finish off my bandage. Now this isn't going to stay up on its own, right? That's kind of, you know, the problem with knee bandages. Many times I might combine this. There's a, you know, wound at the knee and the lower limb. And so what you can do to keep it on is I would use a short 2-inch vet wrap at the bottom. We did this at the track a lot. I'm going to start at on the vet wrap so it has something to hold onto. And this stuff is very sticky, but not very stretchy. Again, pre-stretch it, pull it out this way where you put it on. Just like that. And then of course you're going to need some at the top, and I'd use this thicker 4-inch, 3-inch elasticon. I pre-stretch it on the bars of the stocks at home or at work. And again, I'm going to start at the bandage, whatever I want to hold up, and you can go pretty far up. See, you got so much meat here on the upper limb that you can get a little bit tighter, but I don't go too tight. I try to use the stickiness of the tape rather than the stretchiness. I'm just going to finish right here because this can be a pain to come off. Oh, this stuff gets sticky. Now, if I have to do a stack bandage, say I have a wound on the knee and the cannon bone, I wouldn't have done any of this elasticon until the very end. This elasticon wouldn't be there, and I would actually continue my bandaging with the Telfa through here and use this bandage as a support wrap. So that's how you'll do a full stack bandage throughout the knee and limb, and that's probably the easiest way to do it at home. Okay. Like that. Right. So now we're going to do probably the trickiest of all is the hock. So this is the area of the hark or tarsus. So a lot of injuries I get are horses that jump through the fence and have a cut over here through the skin or through the joint. So always call your veterinarian, but you can get a pretty quick, easy bandage on using your same technique. So I got roll cotton and the Telfa, and say I'm dealing with an injury over the hock here. Again, you just got to listen to what the hock wants to tell you. It's going to look ugly at first, but just go with it, okay? Going over the injury, and maybe you don't cover the point of the hock just yet, but that's okay. I want to kind of go down, and I'm just trying to follow. You'll see that as I go down, and I have to go up in almost a figure 8 kind of configuration. Okay, and this is perfectly appropriate, and it's going to get the job done. And if you have other scrapes or wounds throughout this part of the limb too, you can put extra Telfa or wraps on it there too. Okay, then I'm going to follow with my vet wrap, and again, just trying to follow the lines of the angles of this hock the way it wants me to. Don't force it too much, almost figure 8 or X shaped here. Trying to keep Everything's straight. And not too tight that you can still see the ridges of the vet wrap. Once again, I'd put elasticon all the way through up here and at the bottom, but I'm going to demonstrate how I'd pair this with a lower leg wrap. All right, I forgot to mention that I put up her tail, as you can see, because that'll help, you know, for bandaging anything in the back legs, keep things clean. So I have a cut through the front of the hock, or somewhere around the hock, as well as an injury to the lower limb. I do my telfa, or maybe I want to keep this bandage up and keep her supported for the trailer ride to the vet. But I would do the same thing using my clean non-stick padding diaper or menstrual pad, and then the roll cotton. And I do have a longer, taller type stable wraps for the back legs. So I'm going to tell my horse that I'm here, tell her to settle, behave, don't kick mom. And it can always be awkward to do a stack bandage in the back leg, but don't be afraid to go a little low, because that'll be okay. All right, and I'm going to start around here. Go low, because I got to get back up to the top. I have a lot longer limb, I should say. The cannon bone's a lot longer than the front cannon bone, and the hock makes it seem that way too. Just keep a supportive bandage just to the base of the hock. And you can put elasticon on top or leave this like right here, any sort of supportive bandage, but I want to keep my hock bandage up, so I'm going to wrap around the hock. And again, you're in the safe zone here, or safer zone. You don't want to get too tight around this basically equivalent to the horse's hamstring here, but I pre-stretch my elasticon halfway. Old elasticon gets stickier, but now I have a sticky bandage that will stay on and stay up for the trailer ride. So there you have a pretty sturdy bandage for the trailer ride until you see your emergency vet. And like I said, you can always combine this with the combine and do vet wrap all the way if you prefer, or don't be afraid to stack from vet wrap down to here and then keep everything up with elasticon. Again, it depends on the injuries to your horse, and always consult with your veterinarian regarding how you're going to want to do this. But I hope that this video gives you good basic techniques for managing different parts of your horse's limb, different techniques, different tips and tricks, and what to have in your hospital. So thanks for Marquesa for not killing me today. If you have any questions, feel free to message me or talk to your vet, okay? Good luck, you guys.